So today we start with the skull, with the head stuff. And then we have another head next week. The head is the part of the centerpiece of the skeleton. So this whole centerpiece is part of the trunk thing, and we call that the axial skeleton. And that's from the term axis. The spine and the thing is sort of the axis in a car kind of thing. Affiliate sideways, the bar going up and down. And then the head is the skull's part of that, and the sternum's part of that, the clavicle, the ribs, the sacrum, and we'll talk about all those bones. Today we start with the skull. And then the appendages are called the appendicular skeleton, the appendages.
So the inner core part is your
axial.
Axial, and then like the outer range is the appendicular?
Yes, yes, exactly. And actually, look at that, there's a slide. I got a slide for that. My mom just arrived yesterday, so I'm like a little giggly about it.
You should cancel class.
Huh?
Hang out with your mom, cancel class.
No, she's got jet lag now, she's asleep. I hope she's asleep. I tried to work her all day. She took me to the office and it was busy. So it was fun. But it's kind of nice because she knows some of the patients. And they're such old patients a lot of times. And so they like meet each other again. And it's like, it's great. I love it. Anyway, here, axial skeleton, skull, the ear bones inside, hyoid bone here in front, the chest bone, the ribs, and the vertebral column. That includes the bottom part, and the bottom part is called the sacrum. We'll get to that. And then the appendicular is everything else. So you start with the clavicle and the shoulder blade, because that's how the upper extremities are attached to the trunk. And down here, you start with the pelvis, because the pelvis is kind of the equivalent of these two bones up there. It's what puts it to the trunk, lower extremity. Okay, so let's see. That's probably the first question, since I'm that organized. Yeah. So yeah, you can tell I didn't pre-read the questions today. All bony parts together. We have our limbs attached, blah, blah, blah. So what are these then? Axial? Good. Not the extremities. Looking at the head, one sees a face, nose, there is a brain behind it. That's right. The skull is composed of many bones. Some concern themselves with enclosing the brain. Others create facial features. Choose bones that make up the skull cap. The calvarium. All of them. Which ones? All these, no? Not this. Not the cheekbone. Zygomatic is the cheekbone. So this is the considered touching, scratching the forehead. Right in front of your head is conveniently called the frontal bone. Thank God. When you walk into the front with the head, that's frontal bone. I'm sure somebody hit their head the day before they named that bone or something. The one is, we find an eye socket as well, the bony part of the eyebrows. What do we call that? That's the artery, right? So let's find that. Ta-da! Ta-da! Ta-da-da-da! Well, no, where is it?
You said it in the video.
Ah, you have to watch the video. It says, well, that is part of the thing, of course. I could, can you tell me after class to make a note to write it in next booklet version? Because I should write it in, but we have the supraorbital foramen means whole, right? So we also partly talk about how to read anatomy language in this class. So some of the stuff comes back over and over as terms. And one that always comes back is the word foramen. See that? Foramen. That means whole. So when you actually touch over your eyebrow and all of a sudden that's a little indentation right there, that's a hole. There's stuff going in and out of the head. It's right here. There's the hole. And the plastic models are not that great from all the detail perspective. They're good for us, but they're not more detailed than that. And so we already know supraorbital can be that, right? And so yeah, it's in the video, and the rest you kind of have to deduce a little bit. But we'll make sure we'll put a picture, the label in it. You got me. the other part of the term that is interesting, if you just not know it, but you can deduce terms, you see the word supra and the word orbital. Here, supra, that always means superior, above something. It's from superior, supra, I think. Yeah, probably. But you know that you can at least connect the two together, and then you know it's something above. And orbit is a round thing. The globe is an orbit. So this is the thing over the orbit. And so that's how anatomy kind of works. You know, you can start in some ways piecing. It's like a puzzle a little bit. You can start piecing the stuff a little together, and it's good to know what these different things mean. So one of the things you can make is a list of things that I talk about, or there is booklets you can buy. That's really cool. It's here. A dictionary of word roots. Because, you know, for me it's really, really difficult to just read a text and not glance over and go like, and I don't make the connection and so something like this where I can look up what those words mean is very helpful. Or a medical dictionary, they tell you those things. Don't look that stuff up there. But start with a list, whatever we talk about, and make flashcards for it, and that's the simple flashcard. So foramen means hole, supra means above, orbit means eye socket or around something. Okay? Cool. But make sure. So we have that. Supraciliary arches. I just think it's such a beautiful word. That's why I put it in there. It's the arches. Two other bones are behind it on either side above the ears. They make up a large bulk of the top of one's head. One of the main chewing muscles attached to it. You can feel it by placing your finger above the ears and bite down and chew. What's that? Parietal. There you go. Parietal. Ha! There you go. You can pronounce it however you want. So you can say it parietal. And you know, you go to some European country and you find somebody who pronounces it that way. But we say, and it is parietal. Most people say parietal. Parietal. Parietal bone. Not too much stuff on the parietal bone. The frontal bone is pretty big. Parietal bone looks like that. You know, it's a lot of that attachment but it's very shallow. It's very hard to find when it's outlined for a labeling thing. Okay. Oh, look, this is a long one. If you touch the top of your hand, it's quite smooth and rounded. If you push a little deeper and rub your fingers across lengthwise, you find a groove. If you don't have one, have a big one. Just cross the joint. That's a joint. Did you ever think of that? I hear that's a joint inside there. All that jaggedy line thing on your skull on the table, that's a joint. It's the jaggedy line joint. Oh no, they call it a suture, not a jaggedy line joint. But it's we have some places where we have the bones. It's like a joint that's like that, interlacing bony parts. And so it doesn't really move too much. It's when we think of a joint, we think of an elbow joint, right? But some joints don't move too much. But this moves very little. If I hold my hand on your head, it goes a little like that, a little like that, a little like that, a little like that. It's like your balloon. Your head is a balloon.
I see how it goes in like a T, kind of, like on the top of the skull right there. Does it move like this?
You mean the T is this way?
Yeah.
From the inside up?
Like,
No, it's like this. It's like this way. This way.
okay.
So interlocking is this way.
Okay.
I have an exploded skull somewhere, but I didn't get, and there's nobody over there where it's at. So hopefully during the lab I can get it. So that joint is called the suture. Blah, 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 blah. Interlocking bones to cross reinforce the fibers, move a little bit. What is between parietal bones called? What's the suture between the parietal bones? Sagittal suture. Sagittal suture. Let's go to suture. We have multiple, so this is the jaggedy line, so that's the suture. And you know, if you do massage and craniosacral therapy, that's what we work with. That's craniosacral therapy. Work with the cerebrospinal fluid in there, so it moves a little bit. If you hit your head on something, it's going to be stuck in the jaggedy. So most people think, oh, it doesn't move anyway, and then it's stuck on top of it, and it starts hurting on the inside. Bad idea. I have I have a technique. I put a balloon up into the nostril, attached to a blood pressure cuff thing, like finger balloon thing, and I go, and it pops the skull open again, and it moves it. And it's like a little weird, but it really works great. So we'll talk about that some more. So the sutures are those joints. So we have a coronal suture. Remember chapter 1, the planes? Sagittal plane. Comes back now as a word. Sagittal suture. Coronal plane or frontal plane. Coronal suture. And then we got one back here in the back going up and down like that. And they call that the lambdoid suture because it's like, oh sorry, I just hurt your neck. It's like a lambda letter, the Greek letter lambda, that way. More or less. And those are the main ones. Oh no, the squamous suture between the parietals and then the next bone, the temporal bone, they're very flat. They're right here. And they're not like that. The squamous suture is like that. And the reason for that is when your baby's born, you got to squeeze that head to get down through the birth canal. It's narrow down there. And the head is big. You know, I mean, think about it. That's that hurts. I don't know. All right, so well, back to, you got that suture thing more or less a little bit? That's all we need to know about that. When a baby's born, oh look, we just did that. What do we call those soft spots in a baby's skull? When a baby's born, we have the soft spot. What do we call them in real life, in the anatomy life? Fontanelles. There you go, good. Next, that brings me to the bone behind the ear. Ha! I like that. The ear canal is actually that houses the entire hearing apparatus. So we gotta, when we look at that bone, this is now where we take the skull out, open the skull, and I put that label in, I think, in this booklet. So this bone is right here. Behind the ear is that bone. So the ear canal, where you stick your finger in, is right there. Becomes a bony canal, and then here's cartilage and stuff. And then when you go deeper in, and of course there's an eardrum somewhere. You heard of an eardrum before? We'll talk about that in neurology. And then on the inside, you see this ridgy thing? Open the skull up. Take those two clips off, and then take the head off. And don't visualize, just take it off. You see that ridgy thing? What is that ridgy thing called? The petrous portion. Perfect. And that's where the whole hearing apparatus is. We have a model back there. See the ear, the big ears? That's the model when we talk about all that hearing stuff that gets in a little while, but when we get to the brain and neurology. All right, so that's good. And I think in the booklet, I have it labeled. Ha! I put the arrow in so you know where it's at. There you go. Petrous portion, there's the arrow. That's that portion. Good. I know I learned how to do arrows. That helped. The back of the hat, a couple of interesting bumps and ridges on them. Those are actually muscle attachments. See the bump here? Another major feature of the occipital bone is a hole goes up and down the spinal cord. What is that feature called? What is the hole called? So go back. What did I say a hole's called? Foramen, right? Right. I know. It's 3 words you gotta learn in that one thing. I know it's a lot. But foramen, so now I'm asking for a hole that goes up and down the spinal cord. Right. There's only one word with a hole. I mean the foramen. So most likely it's gonna be that. Got it? Good. So on the test you got the terms. They're actually in order. On the skull terms, you see the label is in a hole and you see foramen, you go, oh, that's probably it. I only put a couple of foramens on. There's a lot of foramens in here, but you learn that in bio too. Somebody else can do that. That's a lot of work. And then we have other bumps, they're muscle attachments, and so when you touch the back of your skull, back here, there's a big ridge. You feel that big ridge on you? That goes up and down here? And then underneath it, you've got ropes. Feel the ropes going up and down? Those are muscle attachments. That's your trapezius muscle. If that's really tight, we gotta talk. Everybody's tight, huh?
Yeah.
That's a normal type. So what we were talking about right here is the occipital bone. So that's actually the bone that you touch it. That's the greater occipital protuberance. A protuberance is something that protrudes, sticks out. So again, we got it in a word. External is outside, occipital, well, that's the occipital bone. Right? So that word makes sense of those words. Spend time. There's no wasted time if you think you're very slow in this studying and it's looking at the verbs and trying to make sense of it. I've done it that way, and 10 years later I always thought I was so slow. But at the end it's thorough, it's not slow in this material. So just remember that if you have a little doubt sometimes. I have sometimes. Next we look at the inside of the chamber of the brain, taking the top of the skull off. Looking down, we find main areas actually lay on 3 different levels. List the bones that make up the posterior cranial fossa. I gotta look that up. So what's the big one here? This is the anterior cranial fossa, middle cranial fossa, posterior cranial fossa. And once in the posterior cranial fossa, we got one big one that's there. What would that be? Occipital? Orbital.
Sorry, occipital.
Occipital. So definitely occipital is on. Now I got to go look at it myself. So I don't memorize those. Look, posterior occipital, and then behind the ear one, temporal. So when you look inside the skull, you see these lines. Those aren't mold lines. Those are sutural lines. So you see the occipital bone is this back part here, and then the temporal bone goes out to the side a little from this ridge, and so it's part of that posterior fossa too. Those two, huh? You can only see a little bit of the next bone, the outside of the skull. Most of it is hit in the inside, crosses from side to side, known as the keystone of the cranial floor. What is that bone? Whatever. Yes, sphenoid. Sphenoid is good too. Sphenoid. The bat bone. And this is the wonderful bone. I mean, look at how crazy that thing looks. And that's basically looking into the mouth. That's the roof of the back of the mouth kind of thing. So you got some muscles attached here that help the chewing mechanism, which is moving this big bone here. The mandible, moving the mandible around. That's the chewing. So you basically, you see these two things in the back of the mouth coming down when you turn it around? These two weird things, these plates kind of coming out? That's these two things on that bone. Just turn it around, turn it upside, turn front to back. So that's a cool looking bone. And the thing is also, it goes across the skull. And so every other bone of the skull is attached to that bone. We have the frontal bone discussed, that's attached to the bone. We got the parietal bone, that's attached. The temporal bone, that's attached. The occipital bone is attached as well to it. So if you slam your head and get a concussion and can't stand on one leg anymore because your whole movement apparatus is goofy, if we can work this bone, that's why craniosacral, that's a big bone. We can work this bone, we can work all the other bones and joints together. And so that's where you can, and there's a technique that I have learned. You take a balloon and about this big, you go slowly, got it up here, and you pump it up twice and it clicks the bone back and it releases all that tension. But that was the power of setting, undoing the damage, that's the bang, sort of undoing the jamming that the skull sustained during the injury, and sort of undoing that repeatedly instead of just leaving it alone. That was the brain's then on the inside. The brain can breathe again and do recovery because those joints move a little bit. But you have to acknowledge that they move. That's the first step. And a lot of medicine does not. And so a lot of treatment for concussion is still lay in a room, in a dark room. They don't even talk about omega-3s or vitamin C's or all that shit. Sorry.
I was just gonna ask, what is that technique called?
Nasal specific technique. I got info on my website and I can talk about it. It's pretty cool stuff. So yeah, but that's my non-wanting to. It's not about promoting myself, but these, if you're following your head, call me. We'll talk about it. All right, the last bone technically part of cavernary houses the brain lies behind the nose. It's very delicate and helps us with the function of smelling. What bone am I talking about? Another one of those bad words, huh? Sphenoid bone. And that's just the inside of the nose. If you go in and you push on the side, on the inside, you touch the sphenoid bone. Very delicate. If you get sinusitis stuff, you know about that, if these things in here inflame. All right, and then we get to the facial bones. Oh, let me show you the picture of the ethmoid. Here, see the ethmoid? I mean, if you have a real skeleton in front of you, don't put your finger up the nose. You break the stuff off. A real skeleton, don't put your finger up their nose. Yours is all right, but their nose. I mean, you don't need their boogers anyway. Because it will fall, it will break. It's so delicate. This bone will break apart. It's so delicate. All right. But next, the maxilla. So now we get to the facial feature bones. These are these bones. We got this bone, we got this bone, we got the cheekbone, a couple more things. The maxilla is the central bone of the face, which means all others attached to it. It's where the upper teeth attach to the bone. What are the teeth sockets called? There you go, alveolar margins. All right, so all the teeth, so that's the upper of here. All the things, so these teeth going into the bone is a joint. We'll talk about joints coming up. Now, first faces, then joints. And so, but it's not supposed to move. But it is an attachment from one bone to the next bone, and it's got ligaments on it and all kind of stuff to stick that thing up there. It actually has periodontal ligaments around the teeth stalk. And listen to the word, periodontal. Peri means around. Odontal means to stuff. So we can see it again in the word. And I had this pain when I wake up in the morning about a year ago. I wake up in the morning, it's like not burning, but achy. Not like a toothache, but achy a little around here, not one thing. I went to the dentist, and thank God my teeth didn't have a hole in it. But I was biting down at night, and the periodontal ligament got loosey or whatever, and the bone pushed the tooth against the bone. And I always thought, oh, that ligament holds the bone in, so you can't pull it out. But it also creates a springing effect from the tooth to the bone transmission of the force. Interesting. So I said, you could do the night guard thing, and it's gone away. Thank God, it cost me $35 at Walgreens. Tea stuff can be pricey, man. Gotta be happy with that. All right, the front of the part of the roof of the mouth is the maxilla. The back part is what bone? Palatine bone. So the back of the roof of the mouth is its own bone. So the front of the roof of the mouth, right behind the teeth, is your own bone, is the maxilla. The back, where there's a little bit of a line, a tiny line, and there's a little bone, and that's the palatine bone. See, it's this just this back part, it sticks on like from the back. The small bone in the medial side of the drainage canal of the tears is called what? Here, next. A small bone in the medial side, remember the word medial? Inside, right? Medial is inside. Or the eye socket holds the drainage canal for the tear. What is it called? Lacrimal. Anything lacrimal has to do with tear. We're going to talk about up there. There is some eyes somewhere in there. There's some eyes. There's a little thing up there. That's a lacrimal gland. Tears. So that's a word that's good to know. The cheeks are made off of their own bone. It's quite unique, funny sounding, somewhat difficult to name. What is it? It's the cheekbone. And we're going to have a muscle that's also called the zygomaticus muscle. And it's the smiling muscle. It pulls the corner of the mouth up. And so that's the cheekbone, the maxilla. No, the zygomatic. Cheeks, sorry. Yeah, we don't need to look at that. when one looks up, the nose of the skull, we can see 3 rounded, downward facing plates of bone that reach from the side each canal of each canal's east nasal cavity. Jesus. They are covered with a lot of blood vessels that can bring warmth to the area and heat up the air as we inhale it. What's the lowest one called? Inferior nasal concha. So concha. So here's a lacrimal. Then bone is called a nasal bone. I didn't put that up as a question. That's right by the nose. You'll figure that out. The zygomatic, and then the turbinates. So they come down on the skull from the outside of the bone inward and point down like that and make this round thing like that. And you can see that here. See that here like that? That's that inferior nasal concha. And so as we breathe, the air goes in like that, and then it has to circulate because it goes through this funnel thing. So it's turbinate. It turbinates, and there's a lot of blood vessels around here. And so when it's cold outside, they can swell up. It's the dry and the cold stuff. But the air breathed in, passing them, will be warmed up and moistened. So when it gets to the lungs, it's not burning. Did you ever go to New York or Chicago in the winter and you breathe through your mouth because you run a marathon or something? Burns down all the way to here. And when you breathe through, you don't run maybe, so you can only breathe through, it's enough through the mouth. It doesn't burn as bad. That's because the air gets warmed up. So if you don't want bronchitis, you breathe through the nose. That's why. Because it's the inferior nasal concha. Well, all the 3 nasal conchas. The nose is divided into right and left nasal chamber. Perpendicular plate of the ethmoid bone creates most of the bony wall in the middle. A plow-looking bone anchors the plate. What bone are we talking about? The vomer. It's deep in. It's that thing sticking out on the front of the nose, on the bottom. It's right there, right there. When you hurt, that hurts when you poke it too hard. That thing is the thing that you poke. That's the vomer bone. I got to revise some of that. I'm sorry. And then we get to the mandible. I'm sure of that, right? Lowest jawbone is pretty much the only that moves quite freely up and down. Do so mandible has muscle attachments. The coronoid process is where the temporalis muscle attached. We discussed when looking at the parietal bones. Do you remember that up here? So that muscle, that muscle that's attached right here and bulges up, goes down and reaches down inward into the mandible, into this part of the mandible. And so you can see how that bone, that muscle here, pulls that mandible close like that from this angle. All right, what's the other one? The bar-looking structure on the side of another powerful chewing muscle attached to it is called the masseter. What do we call that bar structure here on the side? The ramus. There you go, ramus, right here. And so that other muscle, let's see if we see any of that. No, it's the ramus is right here. The masseter is attached to, from here upward to here, and so it closes the mouth this way. So now we got a muscle that closes a little in this angle, and we got a muscle that closes a little in this angle. So that's some good chewing force right here. And then we got 2 more. We'll talk about those next week. This brings me to the front of the neck, which has the only bone in the body that doesn't attach to another bone, only has muscle attached to it. It helps us with swallowing. What is that bone called? The hyoid bone right down here. It's not on your skull. It's free floating. So it's not even here. Some of them probably have it. But no, I can't see it in any of the skeletons. So all you have from our perspective is, it's right here, and you don't squeeze it too hard. That's what with people. Don't squeeze them too hard here because you don't want to break the puppy. All right, good. Any questions to that? No? Good, let's go to work. Oh, now I get to give you the test. Now finally, you were so patient. All right.